Good afternoon from Los Angeles, California. I'm Charlie Coker, Executive Director of Asia Society Southern California Center. Welcome to our inaugural COVID-19 webinar. This is the first of 3 programs we'll be hosting. Our second program, which is planned for the week of April 20th, will focus on the economic impact of the pandemic and will feature speakers from Hong Kong and from Los Angeles. The third program will occur on the evening of May 3rd and will examine the social impact of the COVID-19 pandemic and will focus on the escalating violence and intolerance towards those of Asian descent. For those of you not familiar with Asia Society, it was founded by John D. Rockefeller III in 1956 as a nonprofit and nonpartisan organization. We have 13 centers in the US, around the US, Europe, and Asia. And our goal is to build connections between Asia and the West and among Asians through programs on business, policy, education, and the arts. Our center in Los Angeles was established more than 30 years ago and serves as arguably the biggest and most diverse audience within the global network. We'd also like to thank our co-host for this afternoon and evening, the UCLA Luskin School of Public Affairs for co-hosting. But without further ado, I'm very happy to introduce our moderator, Dr. Seagull Song, who is one of our advisory board members here in Asia Society Southern California. Dr. Song is a practicing law professor, a practicing attorney, and a published author on the US intellectual property law and entertainment law. She is the founding director of the Asia American Law Institute at Loyola Law School in Los Angeles and a guest professor at the Peking University School of Law and the Beijing Film Academy. Dr. Song also previously served on the advisory board of the China Intellectual Property Law Society and the editorial board of the Journal of the Copyright Society of the USA. Dr. Song earned her LLM from Hong Kong University and a second LLM and JSD from the UC Berkeley Law School of Law. So with that, Dr. Song, I turn this over to you.
Thank you very much, Charlie, for the nice introduction. Good afternoon, everyone, and good evenings for those joining from the East Coast, and good morning for our friends calling from Asia. I am Seagull Song, Advisory Board Member of Asia Society, Southern California. Today, we're doing a program related to coronavirus, or officially known as COVID-19. We're very pleased to have 2 leading medical and public policy experts joining us today from China and the United States, Dr. Zhang Wen-Hong and Dr. Jonathan Fielding. We're hoping this program will facilitate a very important discussion between the medical and public health experts between China and the United States so that we could have a better understanding as to the virus and therefore taking appropriate measures down the road. We believe that such a dialogue is extremely important at such a critical time, given that the virus is spreading very quickly around the world. But before we start the program, let me just give you a quick update as to where we are now. As for today, there are over 200 countries that have been attacked by the virus. The total number of affirmed cases worldwide surpassed 1.4 million as of today. Here in the United States, the total affirmed cases are over 390,000, with total deaths to over 12,000. New York remains to be the epicenter of the virus, with confirmed cases over 130,000, which accounts for approximately 1/3 of the total number of cases confirmed in the United States. Here in California, we have the total confirmed cases over 17,000 today, and the total deaths over 400 already. Well, apparently we're in a very bad, terrible situation. But I do have a bit of good news to share with you. So for 2 things. First of all, Wuhan, the city where this pandemic crisis outbreak started in early this year, after 76 days of very stringent lockdown, it finally reopened yesterday. And second piece of good news, for the first time China, for the first time, China since January reports zero deaths since yesterday. So at least we can see there might be hope, there might be light at the very end of the tunnel. We just have to stand together and go through this together. So joining me today are two leading medical and public health experts from China and the United States, Dr. Zhang Wen-Hong and Dr. Jonathan Fielding. Dr. Zhang is a professor at Shanghai Fudan University. He's also the head of the Infectious Disease Center at Shanghai Huashan Hospital. Dr. Zhang leads Shanghai anti-COVID-19 medical expert team. Thanks to his very active involvement in designing Shanghai's containment policy, Shanghai, a mega city of over 30 million population, ended up with less than 400 confirmed cases and single-digit deaths. And therefore, Dr. Zhang has been well known in China and fondly known by the public as gatekeeper of Shanghai. Dr. Jonathan Fielding is professor at Public Health School and also Medicine School at UCLA. He was also the former public health officer and director in the LA County for over 16 years. Dr. Fielding is elected member of the National Academy of Medicine. So today's program will start with Dr. Zhang first, who will share with us his inside perspective as to how China responded to this crisis. Dr. Zhang, the camera is yours.
Okay, thank you, Dr. Song. And it's my pleasure here today to share some experience from China. And everybody knows that today is a very special day that we stop the lockdown of our city, the Wuhan city. And this morning and now in China, so we restarted Wuhan already, and the transmission now in China from city to city restart now. So therefore, after almost 2 months, I think that China today we can say that we managed the COVID in our country already. And I think some experience today here is still then it can be shared by the other country, like some other country like India and Africa. We see that the increase of cases still is a great concern for us. Today also it's a good news that we see the peak of the cases in United States and the European Union now decrease already. Therefore, in the near future, we still will face a great challenge from some country with limited medical resources. So today I will just have almost 10 minutes share the experience from China. Okay. This is a curve for the confirmed cases in China. So from the January 20th to today, we can see the red curve stand for the Wuhan city. The yellow curve stand for the cities other than Wuhan. We see the curve here now, just like Dr. Song mentioned that today, 0 cases in China and 0 deaths in China for almost several days. But you can see that in the yellow curve, there's some very small wave for the second wave. This second wave is the imported cases from the other countries, now still with the epidemic of the disease. So we can see the high peak now in our epidemiology data. We saw that it's emerged around February 20th. So now from February to today, just we spent almost 1 month to control the disease. Here I just share some strategy for the disease. Okay, page down, please. Okay, here is some major measures in China. We took in our countries. So the first strategy, of course, the strict lockdown. I think the strict lockdown is very important for the epicenter of China, the Wuhan. The population traveling or leaving from Wuhan to other cities is strictly stopped. So this is a very key strategy that we took in our countries. So after that, other cities other cities, not Wuhan, just like Shanghai, Beijing, and a great city, just like Shanghai, we have almost we have almost 30 million people in our city. Is actually a major challenge for us after the outbreak of the disease in Wuhan. Therefore, after the lockdown of Wuhan, we did the slowdown and we encouraged our populations in Shanghai stay at home. So I think the most important, the key message is the early control of the local transmission. So first of case, I think is just like that emerged in the United States, was identified on January 21 this year. At that time, the Wuhan's lockdown suppressed most of the transmission of the Wuhan to other cities. And I think it's very successful at this very early stage. But in Shanghai, we just take a slowdown, but not lockdown. We still keep our transmission. We only canceled some gathering activities, and we just encouraged our people stay at home, but we still keep the very important normal life, just like the grocery, supermarkets, hospital, banks, and all life necessary facilities is still open in our city. So it's a totally different strategy in Shanghai, in different cities. In the epicenter, we lock down and stop every transmission, but in our other cities, not so many cases. We just take the slowdown, not shut down, but we will we just close the schools and some gathering activities for short durations. So today, we now restart the Wuhan city, and actually 1 month ago, everyone here, we have gone to work in the hospitals. For myself and others now have gone to work in the companies already. So in China and other than Wuhan, we already take the restart 1 month ago. So next slide. Yes. Okay. So here I will talk more than about the Wuhan. The strategy is about the Fangchang shelter hospitals. So I think it's a very interesting strategy in Wuhan, because once we entered Wuhan, we found that lots of people in Wuhan infected with the disease, and most of the transmission happened in the family. So therefore, we think if we did not stop the transmission in the family, I think we cannot stop the disease. Therefore, in China, we take the strategy to set up the Fangchang shelter hospitals within 1 week. So in China, this is a stadium, it's a map you see here. It's lots of large scale temporary hospitals rapidly built by converting existing public venues such as stadiums, you can see here, and exhibition centers, set up into the healthcare facilities. These facilities served to quarantine, isolate the patient with mild to moderate COVID. So the facility here, I think the major objective just for us to quarantine the people and monitor the people with mild to moderate. And once we found that progression of the disease, we will move the patient to the formal hospital, just like ICU, to take care of the patients. So this is a map of our short hospitals in China, in Wuhan. Next. Next, yeah. So this is a function shot. I think it's actually today we closed all the Fangchang temporary hospitals in Wuhan regions with highest epidemics in China. I think it should be the epicenter, and we set up the Fangchang short hospitals. We recruit almost more than 70% of the transmission cases in the Fangchang hospitals. So even with the practice of social distancing, people and especially asymptomatic patients still have the chance of transmitting the disease to their loved ones in the family. Therefore, I think the hospital is not only a hospital, it's just a hospital for quarantine. Everybody knows that in China, the house was not so big, so it's not easy for us to take the quarantine at home. Therefore, the Fangchang Short Hospital here help us to quarantine the people and monitor the patient and give the medical care with the mild to moderate patients here. So I think it's very hard for us to set up the Fangchang Short hospitals in China within very short durations. We can see here the up down, there's a lot of dots here. This is a Fangchang Short in the city map. The biggest circle, the beds, it's more than 1,600. So it's the biggest Fangchang. It can contain more than 1,600 people confirmed the cases here in the hospitals. So according to the data, we can see here the upright, you can see here, the blue one means that the capacity that we can provide for the patient. And the red ones that discharge the data. So this data is from the February to March. But today, actually, we closed all the Fangchang Short hospitals because new emerging cases in Wuhan now today. So I think a very short duration with temporary hospitals, and we provide the medical care for mild patients, provide the temporary hospital for quarantine, the asymptomatic patients here, I think help us control the pandemic, the outbreak in Wuhan city. Page down. Okay. Now I will talk more than Wuhan city. Wuhan city, you know that it's epicenter in China. But how about other cities in China? China is a big country with lots of population here. I think the experience how to control the imported cases are also very important. So here I just want to talk about some experience in Shanghai, a city with 30 million people here. So you can see the curve here. This is confirmed cases in Shanghai. We can see here there are two waves here. The first wave are imported cases from Wuhan city. After Wuhan lockdown, we take the top level response to the major public health emergency immediately. So the totally cases in the end in Shanghai, actually only 400 cases. So everybody here is very strange about why not so many cases diagnosed in Shanghai. Because I think the only experience for us is that we diagnose the patient very early. We take a massive detection for the patients and tracing every close contacts and give the quarantine at the very early stage after the lockdown of Wuhan. So therefore, I think the time is the secret. The time is the most important fact that we control the disease in Shanghai, with a big city. Okay. Next slides. Okay, so this is a mathematical models. Once the Wuhan outbreak there and a paper published in Lancet, they predicted that according to the mathematical models, the epidemic should trend at the biggest population infected in Shanghai. It should be 800,000. If we take some effective control, I think they think the 80,000 at least it will happen in Shanghai. Actually, in Shanghai, we now know that only 400 cases here. What happened in our city, I think, just I mentioned that the early diagnosis of the disease, tracing the close contacts, quarantine every close contact and the patients, and it's a secret for our Shanghai experience. Okay, next. Okay, so first of all, after the lockdown of Wuhan in Shanghai, we just optimizing the diagnostic flow at a very early stage. Actually, in our own hospitals, we set up the diagnosis system earlier than the CDC. Actually, only several days later after the lockdown and Shanghai, we take the diagnostics, the very massive testing, and for every suspected cases, and we're tracing every patient among the suspected cases, give the quarantine the policy in our city. Okay, next. So this is a criteria at the very early stage who will request the COVID test. In Shanghai, we opened 117 designated hospitals with fever clinics. Now we added more than 182 plus fever sentinel hospitals. All patients who came from Wuhan or have the close contacts with Wuhan people, and if the patient have the criteria for symptoms, just like a fever, cough, we would do the test for the suspected patients. All the suspected COVID patients would be admitted into the quarantine ward. So in every hospital here, we have our quarantine ward to have the suspected COVID patients live and do the test for them. The CDC staff would come for sampling and do the epidemiology question. I think this is very unique in Shanghai. We have lots of people in CDC staff. In Shanghai, almost 2,000 to 3,000 CDC staff. They will do the tracing job. So if the nucleic acid, the PCR test turned out positive, all patients were enrolled into the designated hospitals in Shanghai. So in Shanghai, only one hospital, a big hospital with 1,000 beds, that is a designated hospital that will have the confirmed cases. So from mild to severe, every patient with the confirmed diagnostics will be sent to the designated hospitals. Actually, I am the leader of the expert committee in the designated hospitals. And now today, almost now, still we have 150 patients there because all the patients are imported cases from other countries. Next slide. So this is a very early data from our own team. We can see here, left side is about incubation period. The incubation period for the disease, almost 1 week, and within the 2 weeks. The right map, the right graph we see here is the days from symptoms onset to hospitalizations. So our experience to control the disease is about to give the timely diagnosis, but still we need another strategy is give the timely quarantine. I think faster diagnostics and faster quarantine it's very important for us to keep the patients at the quarantine ward and stop the spread in the community. So next. So this is the result of our measures. We take the very early control of the local transmission, and therefore we stop the disease spreading. So this is a bar according to different data here from early data, and then the peak around the end of the January and the 1st of February. We can see here, you will see some colors here. The green color is the green color is the next generation of the patients. The red color is the patient with the travel history of the Hubei or Wuhan history. I think they are the first generation patients. So we can see here the next generation patients. I mean, so it's the patients after the transmission from the original cases is not so many in Shanghai. So the experience in Shanghai for us is to control the spread in the community. And we do our best to decrease the next generation cases and stop the spread of the disease. I think it's very, very important. Today we saw that in United States, maybe in Europe. So the local transmission now is a major challenge for all the public health works there to stop the spread of the disease. So next. So now I will just take 1 minute to talk about the mortality. The overall mortality rate of COVID in China is around 3 to 4%, which is now higher than that in the United States. However, in Shanghai, in our city, now around 1%. So there's a difference in Wuhan and other cities in China. I think here is very important for us to find the cause of the mortality. So I think at a very early stage, if the medical resource in the city is limited, I think mortality will be high. So in the city with enough medical resource, just like in Shanghai, I think we can decrease the mortality around 1%. I think maybe nearly 1.5%, just like in Germany. I think is very similar. The main risk groups are elderly or patients with a previously underlying disease. Young people, I think relatively they with a lower chance to progress to severe disease and a lower mortality in Shanghai and also in other cities, not Wuhan. But in Wuhan, it's the high mortality is really associated with the limited medical resources. Next slide. So, so this is data from Wuhan compared with that in Shanghai. We can see here in Wuhan, if the patient with very critically ill patients, we think that the invasive mechanical ventilation is very important. However, in Wuhan, only 7% of the invasive mechanical ventilation at the early stage. We know that in the very early stage, before the healthcare works from other cities went to Wuhan to help them, the medical resources is very limited. So at the very early stage, the invasive mechanical ventilation rate is as low as 7%. However, in Shanghai, I think this is the later stage in China, we found that the invasive mechanical ventilation rate is very high, 100%. So here, the data, we can saw the mortality in the critical air patients in the very early stage in Shanghai, in Wuhan, almost higher than 50%. However, in other cities with the enough medical resources, just like in Shanghai, only more than 20%. So this, I think, we can find some cause of the high mortality or low mortality. Okay, next slide. So lastly, I just will give the conclusion for today. The key points of medical and health control in Shanghai and China, I think, is related with the following key points. All suspected patients in Shanghai or in other cities in China, at a very early stage, we do the diagnosis for them. All the patients should be tested and sent to the designated hospitals. And the CDC staff help to trace the close contacts. All the nuclear tests and treatment are free in China for the confirmed cases. All diagnosed patients should be admitted to designated hospitals, and the close contacts traced I just mentioned. I think is very, very important at this very early stage. I think control the disease at the early stage, then we can stop the spread in the community. So the other countries today now still majorly I think in the just like the South Asia or Africa, I think today is at high risk. They will still face a COVID pandemic. I think they may be in some cities with the outbreak of the disease should consider using the shelter hospitals as part of the public health response. I think it may be helped. Next slide. So this is some experience from China and Shanghai. I hope that in the future, we can collaborate with healthcare works in other cities to control the disease in the whole world. Thank you.
Thank you, Dr. Zhang, for this very, very helpful and insightful presentation. I'm very sure that our audiences have lots of questions, but please hold on your questions for now until the end of the program. I just want to remind everyone that there is a chat box function at Zoom, which will allow you to feed us with your questions. So please continue to use that button and send us questions. Now let's turn to Dr. Jonathan Fielding. Dr. Fielding, the camera is yours.
Thank you very much. And I want to thank my Chinese colleague for a wonderful presentation. Much of what we've learned about the epidemiology of COVID comes from the excellent work in China. So we are much in your debt for that. If one looks at the timetable, our first case was not reported until January 20th compared to December, the end of December, when the Chinese officials informed WHO about the cluster of patients with mysterious pneumonia. It wasn't until the end of January that we banned foreign nationals from entering the US if they'd been in China. And if you look at the first death of on American soil, it wasn't until the very end of February, so roughly two months after the first report in China. And if you look now, we have, as of yesterday, 352,160 cases and 10,369 deaths. So we've had a considerable impact of this. We project going forward between 100,000 and 240,000 deaths in the United States. This is based on estimates from top government scientists. It's corroborated by similar models by public health researchers around the globe. We hope it would be less than this, and the possibility is it may be less than this, but we really can't assume that. And it factors in, importantly, the physical distancing measures that are absolutely essential. And it's important that we keep everybody compliant with these measures if we don't want things to get worse. One of the hard things has been trying to get fatality estimates, and the presentation from China suggests that it is a little about maybe 1.5%. Our problem is we don't have enough denominator. We haven't done enough testing, so it's very difficult to come up with an exact number. What is really important, of course, is the fact that from the publication in Lancet, that for those under 60 years of age, it was only about 1/3%, but it goes all the way up to 13.4% in those aged greater than 80 years. So there's a very steep curve there. If one looks this week, we're very concerned, of course, about the doubling rate. And we want the doubling rate. When you look at China, doubled in 50 days, that's ideal. We were at 3 days last week. We're now at 5 days. So we are making slow but important progress. So that's the number of total confirmed deaths. Takes time to double. You can also see, if we look at our rolling 3-day average, that we unfortunately are in the top part of this graph. You can see the green arrow, basically the green line going almost straight up, whereas other countries, South Korea, Singapore, Germany, even the United Kingdom, and Italy and Spain have now gone to the peak and are starting to go down, which is what we expect to do soon, but it's clear that we have been an outlier. The United States is made up of 50 states, and what we see is that there are major differences in the frequency of COVID virus infections in different states. So you have the high of New York, which is at 6,662 per 1 million population, and all the way down to 261. So we have a huge variation in different parts of the United States. There are a lot of things that influence that, but that's something that has to be considered. What do you do in each of these cases? Do you do the same thing, or do you treat them differently? It appears that 20 to 40% of transmissions in China appear to have occurred when the patient was, when the individual was not yet symptomatic. And our most recent estimates here is it could be as high as 50%. And because of that, our CDC broadened the guidelines on who should wear masks in light of the high level of symptom-free cases. So you now see that much more commonly when you go out than you ever did before. The state's responses are quite different, and that's one of our challenges. If you looked at as of April 1, and starting in the upper left, you can see difference in terms of the large gathering bans. They're not the same around the country. The same with paid sick leave. It's hard to believe we are one of the 2 countries in the world that does not have paid sick leave. But this obviously is a time when we very much need it. We need people not to go to work if they're sick. Third, we have non-essential business closures, and you see that again. We have it concentrated in the West Coast and in the Northeast. And then mandatory quarantine also was very different. So we did not have a unitary response to this, and that has been one of our challenges. We also know that when people travel, the chances of transmission are greater. So you can see here that if you look compared to the prior travel, the gray is those that have no travel, and the red would be those that have normal travel. So the ones that have normal travel are much more likely to have states with increasing and harder to contain levels of this virus infection. But again, you can see how variegated it is. It is not the same everywhere, and we have to have local responses as well as national responses. And some states, frankly, have responded much too slowly. In Florida, for example, where we have one out of every 5 residents is 65 or older, and the response has lagged well behind other states. So, for example, the state beaches stayed open during our spring break from college, where you had tens of thousands of, or maybe hundreds of thousands of students on the beaches in aggregations and in very close contact. And that obviously is a big problem. The governor public downplayed the risk and resisted a statewide lockdown until the 1st of April. So one of the things we certainly know is that time is the enemy. And this is an example of when you, unfortunately, give the enemy too much opportunity. Our peak resource use is another challenge for us. This is assuming social distancing through May, but the peak resource use is expected on April 15th. And you can see on the left-hand side, at the bottom there, that we need 140,823 beds, and we have a shortage of 36,654 beds. And that is, we are making progress. We are using recreational facilities and stadia and convention centers and the like to try and reduce that. And there's a lot of progress that's been made. Still, it's troubling. And what's more troubling is we need 29,210 ICU beds, and we only have 16,323. Our shortage, I'm sorry, is 16,323 beds. So that's also very serious, but most serious is that we need 24,828 ventilators, and we do not have anything like that. So we project a significant number of COVID-19 deaths on the following day after April 15th, but still, we need to have a way of getting material and machinery to the places that need it, because not every state is on the same timetable. So for example, we could have things be used in New York now, and maybe 2 weeks from now they need it in Florida. We need to have a way to logistically manage the importance of having the right materials at the right place at the right time. One of the key questions that we have is, do those who are infected become immune? To what degree is that, and for how long? How susceptible is the virus to mutations, and what are the likely consequences? We know that coronaviruses can be unpredictable in how they impact the human immune system. For example, with the common cold, we know that in general, the viruses that cause the common cold, including coronaviruses, don't develop lasting immunity. It's a big issue, but people sickened by SARS tend to develop immune responses that have lasted. Which does this COVID virus fit into? Because it has big implications. One of the implications is, if people have shown evidence of infection, those people can then not only go to work, but can help others, can volunteer in their communities. And we unfortunately, we do not have a test that is in wide use. I would put the stages of federal response into four. And I'm going to quote our president. In the first place, we did not think this threat was important. President Trump said we have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine. In January and February, we exported millions of dollars of ventilators and PPE to China. And unfortunately, we rejected the offer of WHO that had good diagnostic tests when we did not. And in the middle of February, CDC announced a problem with its test kits. It unfortunately has not been a very pretty picture. It's taken a long time. And in fact, because the public sector, the CDC, was not able to get a viable test early enough, our FDA, Food and Drug Administration, allowed other labs to basically self-certify and to, in fact, then look for themselves and do their own reporting. Still, the numbers are pitifully low. The threat was recognized, but perhaps the risk was downplayed. That was the next stage. President said, we're prepared and we're doing a great job with it, and it will go away. Just stay calm, it will go away. So in this period, however, doctors were really anxious because they did not have enough tests to diagnose potential cases. In California, on the other hand, Governor Newsom declared a state of emergency in California after the first COVID-19 death in that state. So in March 8th, CDC had tested fewer than 2,000 people versus the hundreds of thousands and perhaps millions in China and South Korea. A pandemic was declared around the same time. But look at here's, I think, the most telling slide about tests. If you look here, we're having 5 tests per million as of March 8th, when Guangdong, China, had 2,820 per million, and South Korea had 3,692 per million. So we were so far down that it was almost impossible to get the testing that was needed, and possibly took a very long time to get results. And the lack of population-based testing really influenced our progression, and unfortunately made it much worse than it might have been. The third stage was confronting the pandemic. March 13th, President Trump declared a national emergency and indicated, he said, we're using the full power of the federal government to defeat the virus, and that's what we're being doing. And then the fourth is really putting the nation on a footing that you hadn't seen since World War II, perhaps, as a major conflict. We will win this war, he said. When we achieve this victory, we will emerge stronger and more united than ever before. So that has been the political side of this. And now let me go over a few lessons that are perhaps broader, but I think important. And one is that we have a smaller and smaller world. We have a smaller and smaller world. We have increased density. We have the potential of having an additional 3 billion people, right, in 20 or 25 years to this small planet. So the world has gotten smaller, but mobility has increased. Travel is easier, and it's impossible really to control entirely movement between states or provinces or even countries. So we can't think that that's the way we're going to totally calm the spread of a novel virus. I think another problem we broadly have is it's very hard to imagine the scope and the scale of COVID pandemic. If you think of it 6 months ago when people said, what would be a terrible pandemic? One would say, well, the flu, any kind of flu. And that's the experience we've had. We've had a number of bad flus, including H1N1. But one can hardly imagine, because we've not had the experience of a pandemic that would require the closing of schools, the limiting of travel, the prevention of large assemblies or meetings, sports events, home isolation, quarantine. And we're just not, we wouldn't have before have thought of this because it was outside kind of the scale and scope of our normal decision making. The other thing we're not used to is making decisions for the whole nation that would really limit behavior so quickly. And yet we know here, because of the exponential growth of the virus in people, that we have to make decisions very, very quickly. So what that brings me to is, what do we need? We need something that's essential, at least from my point of view, and that is we need strong international cooperation and collaboration. Research in terms of antivirals and in terms of vaccines. We need planning, we need exercises that are international. We need to share information in real time, and we need to take coordinated response. If we don't do that, it's going to be very, very difficult for us. I think looking even more broadly, we have two enemies, collective enemies. One is time and the other is politics. For example, we have to ask ourselves why we refused the WHO offer of assistance with diagnostic testing when we were having trouble ourselves. So I think what we need also is, if we want to have good compliance for the population, we need a single scientific credible spokesperson, at least at the national level. We need a single scientifically based message. We need total transparency. And we need evidence based on actions by political leadership, evidence-based actions that, in fact, people say, this is what I know, this is what I don't know. Whether it's popular or not, we have to go where the science takes us. One of the problems in the United States is we do have a federal system. It's not necessarily always a problem. It's a great source of strength, but we have federal law, we have state authorities, we have county, and we have city, and they're not always in lockstep. So you can have counties doing very different things, cities doing different things, counties doing different things. And we also did not have a central place for allocation of equipment and supplies. So the states were all trying to get their own supplies of ventilators, and they're in essence competing against each other, when we really think that we should have had the federal government making decisions of who needs it based on a bunch of evidence-based and clear criteria. So I think for all of us, the biggest risk going forward is lack of a long-term memory. Too often we see that something that's out of sight is out of mind. We hadn't seen anything like this for a century. But at the same time, in the last few years in the United States, we've had a 25% reduction in the local public health workforce. And when the key to the early stage, when the key to trying to reduce the problem in the early stage is really contact tracing, we need to have a lot of boots on the ground, people with experience, and we don't have enough. It's also disheartening that the White House Pandemic Preparedness Office was disbanded. That could have been helpful as well. And there are also recommended reductions in budget to our CDC. So we have to think that through again, and we have to make sure that with behavioral issues, people don't get lax too early. As Governor Cuomo said yesterday, I think, one of the risks is we get reckless. And we can't get reckless. We need, even when we've passed the apex of the viral impact, to say, yes, we still need to consider what behavioral constraints need to be put in place, and they probably need to come off not all at once. For example, you might have people saying, well, you might have allow that people could go to restaurants again, but with the right kind of spacing, and maybe temperature, at least infrared looking at temperature as they come in. You could open grocery stores, but that still wouldn't suggest that you should have large assemblies or that people should be able to crowd together. So trying to change all our behavior is new, but it's the essential if we're going to go forward as a healthy planet. Thank you.
Thank you very much, Dr. Fielding, and also Dr. Zhang, for your very helpful insight. I'm sure that the rest of the audience has learned as much as I did from your insight, knowledge, and experiences. One of the questions and issues that we would like to discuss with you, and probably that's a question for you, Dr. Fielding, is the mask wearing policy. For the past few days, we have noticed a change of guidance as to whether the public should wear masks when they go out. I mean, we have noticed that from the very beginning, different countries, including China, the United States, Korea, Japan, and including WHO, seem to have different guidance and mandatory requirements as to whether the public should wear masks or not. So can you comment on as to how important, how critical right now for the public to wear masks or to wear any kind of a coverage to cover nose and mouth in this pandemic crisis?
Well, it's important. I think the best evidence is that it could significantly reduce transmission. And it's, again, an evidence-based policy. I wouldn't say we have it's not like we have many years of experience, but the evidence to date suggests that people could reduce even by wearing a bandana or something like that. I think eventually people are going to switch from that to N95 masks, but we don't have enough. We are way, way behind in terms of their production. It also depends where people are going. Are they going, the first priority has to be healthcare workers for the N95 masks, for example. but there'll come a time when there'll be some situations, people with immune system problems and others, elderly people might in fact want to wear those as a kind of comfort, but also as an important safety message.
Thank you very much, Dr. Fielding. One thing that I liked was you talk about, the lack of testing in the early stage from the US, and also one of the challenges we probably face is federalism in the United States. So another question that I would like to ask you, which is probably in the minds of lots of Americans here, is the free healthcare policy, quote unquote. We certainly know that the virus does not care who has medical insurance or who does not. So how important is free testing and free medical treatment to all those affected or potential affected, even including those uninsured workers and undocumented workers here? And also, who should pay for such cost?
Well, I think that's a very important question. I think we're doing much better. And the insurance companies, as far as I'm aware, have said they'll pay for testing. And for those who don't have insurance, that there'll be some mechanism to pay for it. So I don't think that that's going to be as much problem as the fact that you couldn't get testing anyway, even no matter who was paying for it. In terms of the care of people with coronavirus infection, that's, I think, a little less clear. But I think that ultimately the government is going to have to pay for a substantial part of that for people that don't have a private insurance, because it is an issue that affects all of us. And I think it would be wrong not to cover everybody. In fact, everybody should be covered. My view is that everybody should be covered by insurance, and it should be universal.
Thank you very much, Dr. Fielding. That's very assuring, and I really hope the federal and state governments will listen to your opinion on that issue. Dr. Zhang, are you back?
Yes.
Excellent. So let me repeat a question. What kind of medication has been used in China, and also do you have any recommendations as to are they effective, including Chinese traditional medication? Thank you.
Okay, so good. In very early stage, you know that the outbreak of the disease in China, therefore we tried lots of potential candidates for treating the disease, and majority of them may be all kinds of the antivirals. But today, some of the clinical trial, we got the data already. Unfortunately, I think up to now, the evidence for the clinical efficacy was not significant. So everybody knows that our colleagues in France, they published a paper for the hydroxychloroquine today. And China, we got the data. We think the efficacy is also not significant. And we also today, we know that the data from France, so in the world, they think maybe it's not so significant. So up to now, actually, we cannot recommend any kind of antivirals with very strong evidence for the patient. So just like Jonathan mentioned, the medical resource is the most important. I think today, if we can give the patient the sufficient and timely respiratory support is the most important. So in Shanghai, we give the critical ill patients with almost 100% of the patient can accept it as a ventilate. So therefore, I think the timely and sufficient respiratory and other medical support is the most important. Of course, you mentioned about the Chinese traditional medicine. Everybody know that Chinese traditional medicine exists in China for almost 1,000 years. So in Chinese doctors, though they always have the experience to use the Chinese traditional medicine. Actually, in Shanghai, we will integrate the Chinese traditional medicine with our Western medicine together. So today, I think the outcome of the patients in China today is very similar like that in in Germany, in United States. So therefore, I think the Chinese medicine or Western medicine, if they work in China, the patient here can accept that. Thank you.
Thank you very much, Dr. Zhang. Well, it seems that the next question that we pick up from the box is also directed to you. So are you ready, Dr. Zhang?
Yes, yes.
There has been some discussion in the United States as to whether the numbers coming out of China are accurate and reliable. Can you comment on that?
Sure, I think this is a very sensitive question because many people in the world, they think just like in Shanghai, I am the chairman of the committee, of the expert committee here. And actually at a very early stage, I cannot imagine that only several hundred cases I found in our city. So actually the questions are also from ourselves, but it's the reality that today we cannot find any more local cases here. And we start our job 1 month ago. So if you have time, visit China in Shanghai, you can see here, we restarted the city almost 1 month ago. And today I work in the hospitals and we stop the local, the shutdown. And we now restart the job in the marketing, the hospitals and everywhere already. So if there's some emerging cases, I think we cannot do that. But the cause and under the phenomenon is the most important. According to my experience, the very early diagnosis of the patient, of the cases, very early tracing the close contacts and the quarantine, every close contacts is the most important. So we did everything we can do from the diagnostics free and tracing every patient and quarantine every close contacts by our CDC staff. I do not know how many city staff in other countries, but I know that in Shanghai, only one city in Shanghai, we have almost more than 2,500 CDC staff to do the tracing job. So only tracing job, we have many people. I think the advantage in China is the population. So I think the tracing the close contacts, quarantine the close contacts, do the diagnostics as soon as possible at a very, very early stage, I think it should be the secret. So today, actually, I cannot tell you what's exactly what kind of the cause, the real cause for the few cases in Shanghai, but the only one that I can tell you is about really we now restart our city for almost 2 months. We started our city at February 9th and totally restart our city for 1 month. So I think if there are some emerging cases, we cannot do that. I think this is a reality. The secret is early intervention. The early intervention for diagnostics, tracing the cases, I think is the most important. Everywhere in China, other than Wuhan, did that. Thank you.
Thank you very much, Dr. Zhang, and also Dr. Fielding. It seems that we are almost running out of time, so I'm quickly wrapping up some of the questions that we have. The following question is to both of you to answer, to take. This is going to be a difficult question because I'm actually asking both of you to read a crystal ball. So how would you vision that we're going to end this crisis? Is that through a vaccine? Is that through herd immunity? And for how long? Dr. Fielding, would you like to start to take the question?
I'm glad you have an easy question. I think we want to do several things. I think herd immunity will be important in some places where there have been a significant percentage of the population affected. I think a vaccine will probably be ultimately what we're going to use because there could be some recrudescence, some renewal of problems, but we're probably still a year away from having a vaccine. But a vaccine, I think, ultimately will be something that we want to have. We also, though, have to look at is the possibility of mutation. That certainly can occur in other coronaviruses. So that then would change it. And we'd have to go back to kind of the same approaches that we've taken here, where we didn't have any direct drug and we didn't have a vaccine.
Thank you, Dr. Fielding. Anything to add on that, Dr. Zhang?
Yes, I agree with the comments from Dr. Fielding. And actually, I myself, I have great concern about the recent outbreak in India and in Africa. Some of my colleagues today, now they already worked in Africa to help the people there to control the disease. They told me the circumstances situation in Africa is not so good. So therefore, I think without the help of the vaccine, so if we want to control the plague with very short duration, it's not so easy. So in China, for our China, ourselves, actually we know that we cannot lock down the world forever. So after 2 months, we also, our country, we will open the country for the total, for the global, for the world. I think we still will face a greater challenge of the imported cases. So what we will do in the future, I think we will keep the alert in our own countries. The second wave maybe is waiting for us there. However, I think with the experience today we got in China, it is very early and intervention, the diagnosis, tracing the patients, quarantining the close contacts, I think it will still work. So in the future, with the experience from United States, from Europe, from China, I think if we unite together to have a lot of collaboration, I think we can stop the epidemic someday. In the history of a human being, I think always we can control the epidemic, the plague. I have the hope, I think. Thank you.
Thank you very much, Dr. Zhang. I'm pretty sure all of the audience are very happy to say both of you, a very cheerful note in the end. So here is a final question, again, to both of you. We all know that China and the United States were caught in the middle of the trade war, well, as well as other tensions in the beginning of this year. So are you two optimistic or pessimistic as to for these two countries to work together, to collaborate, to combat against this virus? And if so, in what areas? Would you like to start, Dr. Fielding?
Well, I think we have to collaborate. I don't think it's a question of whether we want to or not want to. There's some things that can't let politics intrude, and this is certainly one of them. So whether it's research and the vaccine or direct therapy, whether it's preparedness, what are the best guidelines, what's the experience, whether it's, and then in the response. I mean, for example, if we wind up with this pandemic rooting itself in India or in sub-Saharan Africa, we're going to need everybody to try and help figure it out, because there the density problems are greater, the hygiene problems are greater, the ability to find this is going to be more difficult. So we have to do this for not just because it's a nice thing to do, but because it's an absolute necessity, or we're going to have such a terrible impact of burden of this kind of illness that it's going to hurt all countries and lead to so many millions of deaths.
Dr. Zhang, do you have anything to add?
Yes, actually, I agree that the comments from Professor Fielding. I noticed that something happened in the trade and the economic area, But according to my experience, I know that there's a maybe there's a lot of war in the trade, but China and the United States, in the history, we will stand together in the end. So this is what happened in the history. We noticed lots of times. But today, I think for the combat against the virus, the United States and China, now we have the more capability to invent the vaccine and the virus and to work together, because there's a lot of vulnerable people in the world now still waiting for the help from also from China and from the United States and from other advanced countries. I never concerned about the control of the disease in the United States and Europe, but I have a great concern for the remaining of the world. I think the people from the United States, from China, I think will stand together to help the other people who need the help. So I have the confidence that in the future, we will have more collaborations. I think today is also the start. I think today it's my honor to have a chance to have a talk with Professor Fielding. He's a so famous doctor in the famous public health expert in the United States. I'm very glad that I think this is a very good start for us. Thank you.
Well, and to you, please, this has been, I've learned so much, and I'm so impressed with what China has done. And it's a great pleasure. And I've not only have I learned a lot, I've really gotten a sense of the things that we can do together. And I look forward to that.
Thank you, Professor. Yeah.
And finally, let me just say this on behalf of all the audience. Thank you very much, Dr. Fielding, and thank you very much, Dr. Zhang, for spending the time and sharing the knowledge with us. Before we end this program, there are two things. First of all, our Executive Director, Charlie Coker, is going to say a few words about closing remarks and also a few announcements. But don't walk away yet, because we have prepared something special for you. Charlie.
Yeah, thank you, Seagull. I'd like to also thank Dr. Zhang and Dr. Fielding, and thank you very much for putting on a wonderful webinar. It's been incredibly informative and inspiring to me. And we hope that people will tune in on the other two seminars that we will be having on COVID-19, which we'll be sending out more information on shortly. I also wanted to kind of thank again UCLA Luskin School of Public Affairs for co-hosting. They will be starting their first online events on April 22nd, also about COVID-19, and we'll be featuring Dean Gary Segura of the Luskin School and Dean Ron Brookmeyer of the Fielding School of Public Health from UCLA. So we'd like to support them, and we will be sending out more information about that. We also would like to encourage people to visit our website and find out more information about tomorrow's program, which is about U.S. and India economic relationship, which will be chaired by our, which will be co-hosted by our chairman, Richard Drobnik, and Gunjan Bagla, who's the CEO of Amrit Ventures. And I'd like to thank everybody for attending, but to stay tuned, I think Seagull has a special treat for everybody, which we will exit on a positive note. Thank you.
Thank you, Charlie, for the excellent summary and also introduction of our other upcoming programs. So again, you know, over the weekend, when organizing, hosting this webinar program, it came to us that we really also want to use this opportunity to extend our gratitude to all those doctors, nurses, first responders, and also everyone who is currently working and fighting on the front line. For those of you who know me, my father is a medical doctor. So I know what it takes for them to go through to save lives. And therefore, we have prepared something interesting, special for you over the weekend. We prepared a short video, a 3-minute video, as a salute to those currently fighting and working on the front line. Thanks a lot for many help from volunteers, from local producers, and also students from UCLA, USC, Berkeley, NYU, and Loyola. We were able to finish this 3-minute video within 48 hours over the weekend. And also, we're very fortunate to get permission from the underlying music copyright owner to use the music in our video. As a copyright law professor, I want to say thank you. So before we start the video, I'd just like to repeat this again. There's only one enemy that we're facing together, an enemy that is invisible, that is a virus. This enemy makes no distinction between our race, ethnic group, religion, social status, wealth, gender, now probably even age. So to deal with this, to fight against this, we have to stand united. We are in this together. So here's a video, enjoy, and finally, salute to everyone who is currently fighting and working on the front line. Thank you.
After an outbreak of a new type of viral pneumonia
in Shanghai, China. Doctors check their condition. Patients can
Tonight is the COVID-19 death toll surpasses 8,000降半旗。
We are together.
Today's another day. The pain has gone away. Bring myself to say goodbye to all the tears I've cried.
Sun rising in the sky, and slowly time goes by.
Even more.
Finally find a way to give a meaning to our life.
West side of Manhattan.
Today I wanna feel a sweet breeze on my skin.
Stay-at-home orders.
The time has come to say hello. Turn your feel inside.
Sometimes you have to dream and forget everything.
But never stop looking for home. That's everything you need.
Come together, we can find a way.
Love that pulls me to the sunny sky.
Come to spread your wings and fly away.
Something has changed into my heart. Together we can find a way.
Love that pulls me to the sunny sky. Come, spread your wings and fly away.
Something has changed into my heart.
Rise like a father's star, shining in the dark.
Their minds are always in our broken hearts, but my fears and sad has
Come together, we can find a way.
love that pulls me to the